Still have pain after a carpal tunnel surgery in this area? That's what's called pillar pain. 13% of people have this pain after surgery. It usually resolves within 3 months, but some can even last from 9 to 12 months. That's a year. Yeah, that's way too much time. What are things that you can do to help decrease this pain? Number one would be scar mobilization, which would basically be massaging. You want to pinch and roll that skin around that area. It should move the same as your area on your other hand. If not, then there's some scar that needs to be mobilized. We're not trying to break up the scar tissue. We're just trying to allow your body to move with that scar tissue. So skin rolling and just general massaging. Rubbing that area, rubbing it in all different directions will help decrease this pain. Also, you can get a silicone pad will help protect that area for a little bit longer. You can find these on Amazon. It'll be in the link below. Number two would be extrinsic stretching, which would be trying to stretch your flexor tendons. This will help decrease the muscle tension along that area, which will decrease your pain. Holding this stretch for about 15 to 30 seconds at a time will help decrease your pain. Number three, and probably I would start with this one, would be desensitization. You want to find that area that's sensitive. If you can't touch it, you need to start desensitizing that nerve. That nerve is hypersensitive at this time. You need to start with some cotton or some soft fabric and touch it all the time. You need to send this signal to your brain to say this is not painful. If you do that, that should help your pain and decrease that sensitive nerve and allow you to go to these other things with massaging and skin rolling and stretching. So I would probably start with desensitization at first. Number four, we've all heard it. We've probably all done it. Your therapist has probably recommended it, but nerve glides. Yeah, there's no real research that shows that nerve glides is 100% effective, but they do create tension along that nerve and allow it to glide. So to glide your median nerve, you want to your wrist back as far as you can. And if you can't make it to this area, shorten it up and have your elbow bent. If you can't make it to this area, bring it in front of you and bend your wrist back. Any of this is called nerve gliding, nerve flossing. This should help decrease that pain. Number five, and finally, is scar softening. If that scar is rigid, tough, not moving as much, you need to get some scar taping, start working that scar. Scar can really cause this pillar pain. So really focusing on that and your swelling will help decrease your pillar pain. So funny thing enough is research really doesn't know what causes pillar pain. Let me know in the comments if you're dealing with pillar pain, and let me know if there's anything else that I missed that helped decrease your pillar pain. Was it time, these that I've listed, or is it something else?